Bismillahirrahmanirrahim. I think I've been given the go-ahead by Professor Lubna Miraj to talk today on ethics of organ transplantation and also look at the Islamic perspectives in this. And I'm really honored and privileged that a very high-powered RMU team is already here with the Vice Chancellor Saab and also my dear friend Nizami Saab. So I think इसमें before I go ahead, let me just put a little bit of disclaimers. Okay, I'm not a certified bioethicist and not an Islamic scholar by any means. However, I do not have any conflict of interest, and I'll tell you why. And two-thirds of my 35-year-long career in nephrology has been spent in renal transplantation. But I was mentored in ethics by the former dean, Allah yarhamhu, Professor Muhammad Amin at Shifa College of Medicine. And one of the things he did when we first started the College of Medicine was form an Islamic ethics learning group along with medical professionals from Shifa and also scholars from International Islamic University. So we used to have regular meetings, and I was a rapporteur for that particular meeting and a coordinator of the meeting, and I used to keep the minutes. So that is where I started, you know, looking at the discussions that were taking place between the professionals and their understanding of the Islamic ethics of various issues. Transplant was just one of those topics discussed. There were several other topics, including end of life care and surrogate parenthood and things like that, and withdrawal of support. And those things were there, which are obviously on a daily basis we need to understand from the perspective of Islam as well as from all the different philosophies, even within Islam that we follow. And this particular 2 year time spent from 2000 to 2002, we looked at about 15 to 18 topics, if I'm not mistaken. And somebody then, Shehzad Saab, I forget his last name, he actually, Amir Shehzad, I believe. So he actually wrote a book subsequently on Islamic medical ethics, which included some of the conclusions from this meeting. So these were not the typical Maulanas that we deal with from Masajid. These were Islamic university scholars, PhDs and others who used to discuss these topics with the medical professionals. And we were about 10 to 12, and these scholars were about 6 to 7. So about 19, 20 members on a regular basis. Probably, I forget now, it was like 2 weekly or what, but they used to meet regularly. So, but subsequently, I also have been part of Hospital Ethics Committee, that Shifa in Jeddah, as well as NUMS. And I chaired the Hospital Ethics Committee in Jeddah. And one of the things that we did was we introduced ethics seminars on a monthly basis, again, looking at the same topics. So I think the Sadqa Jariya of Amin Saab continued in different parts of Pakistan and Saudi Arabia through these series. And we also did subsequently introduce Hospital Amin Memorial Hospital Ethics Seminar series out at Shifa as well. And one of the editorials I had written on ethics of organ transplantation was way back in 2004. And today's discussion is an update on some of those things and a fresher understanding of some of the aspects. So I start off with a few examples of the gift of life. And here there was a patient that we had who was declared brain dead. He had come from UK, and he was declared brain dead in Shifa, where I used to work, in the Shifa ICU. And the family and the father and others were approached by the ICU team, not members of the transplant team directly, as it should not be ever. And this transplant was then done. God bless them for the consent. One of the kidneys was transplanted at Shifa, and the second kidney was flown out to SIUT in Karachi. And but unfortunately, as you can see, this was only the fourth diseased donor transplant in Pakistan from after 97, 2005, and 2007. And then we again had a prolonged hiatus till some multi-organ transplants were done between 2023 and 25. One of them was a sister of an armed forces nephrologist, and she served as a multi-organ donor for about 4 or 5 recipients in 2023. And then there was an ultimate act of altruism. Allah Ta'ala kisi ko is position mein na dale ke this lady, her only son, she's a nephrologist out at SIUT, and he was involved in a motor vehicle accident, and he was brain dead, and she had to make the gift of life decision. She was a widow also, and it was a very tough decision, but she did that, and her son's Sadqa Jariya survives through other people, obviously. That was done in 2025. Also at Bahria International Hospital, we had multi-organ transplants, and at IKD in Peshawar in 2025. But these are just a few examples of the disease donor organ transplants that are occurring, and I will tell you why we haven't been able to progress on that, and where ethics and morality comes in all these. So ethics, one would say, is something that is systematically, systematically, actually, ethics examines what is right, good, or just in human conduct. Whereas morality may be the social, religious, or professional tradition of values about what is right, good, or just in human conduct. There's a subtle difference between the two, and ethics primarily derives from the belief system that are prevalent in a particular society. And it's not just the belief systems of the physicians or the physician community. It has to be the belief systems of the patients. So I remember, excuse me, I remember we had a brain death decision at Shifa ICU for somebody who belonged to a particular denomination of a particular church in Rawalpindi. And the family was unable to decide on issues such as end of life support and withdrawal of care. And so our dean, Amin Saab Marhum, he got together uh, people from various backgrounds, from various churches in Pindi and Islamabad. And they, along with the hospital ethics committee, had occupied the center stage around a round table, and they were surrounded by all the faculty members who were quiet participants. Not obviously, they were not part of the ethics committee, but they were allowed as observers. And everything was discussed from the perspective of the patient and the patient's denominations, and how that was used to eventually solve their problem, and they could come up with a decision based on their values and preferences, which is extremely important when we are making these kind of decisions. So in organ transplantation, ethical issues have always been there. We have had anencephalic babies. Can they be used as sources of donor organs? Disease donor transplant in Muslim countries is still a consideration, still not entirely comfortable. The population is with this concept in parts of Pakistan and India or Bangladesh. Living donors, whether they should be all voluntary, or can they be paid in some form, or they should always be unpaid. What about the living donors under coercion? Coercion basically because the autonomy is compromised because they are poor or vulnerable. How about minors? Can they be donors? Uh, we have this issue of condemned prisoners that serve as donors still in China, I believe, and patients in persistent vegetative state. Would you declare them dead? And can you take organs? How about xenotransplantation? Now that obviously is something that will come more and more and more with all these genetically modified pigs, organs, and other things that have been done in the last few years, including for the heart. I think one of them was a Pakistani scientist out in Washington who who was part of the team that did the modification, and the organ survived pretty reasonably in this. But another one, I remember that when I was in Pittsburgh at that time, we had an HIV patient who who was practically dying, I guess. So I was seeing him as part of the nephrology team, and he was on dialysis, and his liver had also failed. and there was no organs. But then, as an N of one trial, with appropriate consent, he was offered a baboon liver transplant. So the baboon liver was placed. He was put on about 4 or 5 immunosuppressants, which I remember, and he survived about 4.5 months. And every day, while this patient was struggling for life inside the ICU, the animal rights activists were demonstrating outside the ICU in support of the baboon's rights. So everything is so relative and everything is, but I think from an Islamic point of view, we need to be comfortable with the concept that Allah Ta'ala ne har cheez musakkar banai for mankind, and by an extension of that, this should be perfectly okay from an Islamic perspective. But then, in America, they have different rules for different ethics, as we can see. So, what are some Islamic ethical considerations? One of the major ones is the sacredness of life and human body. I mean, that is always considered a primary point, and one of the maqasid of Sharia is to preserve the integrity and sacredness of human life. And when we talk about anybody, जिसने भी एक जान बचाई उसने पूरी ह्यूमैनिटी को बचा लिया, और जिसने भी एक जान ली उसने पूरी ह्यूमैनिटी को कत्ल कर दिया। तो ये जो है उससे वी कैन अंडरस्टैंड दैट ओनली इवन वन लाइफ सेव्ड एंड वन लाइफ किल्ड has connotation of destroying or saving the entire humanity, or or destroying the entire humanity. That is how sacred life is, and also the human body, and that is important. The other concept from an Islamic point of view is the human body is an amana or trust. So this is also important to understand that we do not own it. So from an Islamic point of view, since we do not own it, uh, can we actually make a decision regarding different body parts after death, or before death? And this is one of the areas that the Islamic ethicists debate about. What about subjecting human body to material ends? Is that something that violates the sanctity of the human body? And is public welfare or maslaha, does that override individual rights, or both of them have to be considered together? But then Isar or altruism, and putting the interests of yourself below the interests of others, or interests of others above yourself. So the concept of Ithar or altruism and Sadqa Jariya is very much an Islamic concept. But what about sale of organs? Can you sell organs, your own organs, if you do not actually own them? So these are some of the areas that come in when we are talking about the ethical questions from an Islamic point of view. How about inclusion of organ donation in one's will? Can we actually do that as advanced directives? But then the concept of brain death, is brain death, or is it circulatory death? And that is a question that is still being debated. Although I think personally, I've come to a conclusion that the circulatory death has nothing to do with death. And I'll tell you the reasons why, and I'll share the reasons, and hopefully you might have some comments on that as well. And who shall decide whether somebody who's brain dead is actually dead? And then who can decide when to take off life support in cases of brain stem death? And can one then retrieve organs from brain stem dead patients? And like I said, is brain death, or is it circulatory death that is death? And will the sanctity of the human body be violated by retrieval of organs from the dead? And how to define the exact moment of death? And these are some of the questions that come in. So when we want to answer these questions, we have to review the sources of Islamic law and tradition. And some of the sources that we have and we are familiar with, obviously, for us, the Quran is first and most important source, and it's considered the direct word of God. And following that, ahadith with different levels of evidence, again, muttafaqun alayh, and those which have different chains of narrators, and those which have some conflicting ones. So the different sources of evidence come from there. But then there are secondary sources when we do not have direct answers from the primary sources. and ijtihad, which is rational reasoning by intellectual effort, which unfortunately in the Muslim world, I think, is not used effectively. And these are important areas that are there available to us. Urf, which is a common practice amongst a given society. Taqleed, which we more or less follow most of the time, which is dogmatic advice from authorities without questioning reasoning or logic, and we get stuck in this. But then you can also have ijma, a judgment by consensus, either by jurists or an entire community. And then there's khayas, which is analogical deduction based upon interpretation of primary sources, which also includes al-maslaha al-mursala, which is judgment in interest of public, and ihtisan, which is preference based upon convenience or adoption or moderation. So, based on these sources, what could be some of the answers to ethical questions in the Islamic tradition? And uh, so, one of the answers that came in 1985 from the Islamic Fiqh Academy, Muslim World League in Makkah, was regarding in the eighth session. It is permissible within the Sharia to remove the organ from one person's body and transplant it into another person's body in order to save the life of that person or to assist in stabilizing the normal functioning of the basic organs of that person. That was one of the declarations that had come out in 1985. However, for that if it is a living donor, the donor's life should not be harmed in any way. Obviously, you cannot donate single organs. It has to be only applicable to paired organs or applicable to a particular lobe of a liver, for instance, for living related liver transplant. Or donor voluntarily donates without any form of coercion. So the autonomy is primarily needs to be protected, and the procedure is the only medical means available to alleviate the plight of the patient, and the success rate of the procedure for removing and transplanting the organ is relatively high. So when we do that, we need to then go back to the Quran and look at some of the surahs which talk about death. And in Surah Zumar, Allah subhanahu wa ta'ala says, Allah subhanahu wa ta'ala takes the soul at the time of death. So for us, when whatever the form of death is, the soul is supposed to leave at that time. As it does during every night when we sleep, the soul is taken away and it is returned, as Allah subhanahu wa ta'ala says in the Quran, for those destined to survive. And for the others, they are practically dead. So we are dead every night, if you think about it. And yet our hearts are beating, isn't it? So our hearts are beating and our souls are taken away at night, every night. Similarly, when you are when you are having a cardiac bypass and, and the heart is put at a standstill, you're still alive. So, based on some of these things, I'm beginning to become clearer in my own mind, at least, that death has nothing to do with the heart. It doesn't matter whether the heart is beating or does not beat, as long as if you're brain dead, then. But of course, people can disagree, as one should, when you have ethical positions, and there are ethical dilemmas that we are well aware of. So in Bani Israel, Allah subhanahu wa ta'ala says, they ask you, O Muhammad sallallahu alaihi wasallam, concerning the ruh, and say, the spirit or soul is of the authority of my Lord of knowledge. It is only little that is communicated to you. So obviously, based on that, also we 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 sh- we may still have some thoughts and debates that something that have little knowledge about, how can we be dogmatic about it? But I think Allah subhanahu wa ta'ala tells us to reflect on his signs, reflect on his message, and through reflection and through analogical deduction, one should be able to find answers within these ayats as well. And then Allah subhanahu wa ta'ala in Surah Anam says, it is He that takes your souls by night and has knowledge of all that you have done by day. Then He raises you up again, that a term appointed be fulfilled. And that's what I was alluding to, that, in fact, the ayat goes on to explain that those who are destined to live, the soul is returned only to those. And those who die in their sleep, the soul has gone practically for everybody who's sleeping, except that, and yet the heart is beating. So I hope that would stimulate a little bit of reflection on whether the heart is actually required for us to declare death, which is where some of the scholars in the Islamic tradition are very strict, and they do not subscribe to brain death, and they subscribe only to circulatory death. But I think these ayats should provide some food for thought. Uh, Qadi Mujahid al-Islam Qasimi stated that once the brainstem dies, the soul leaves the body. So, there are fatwas related to that. Whereas Sheikh Mukhtar Salami, a Mufti of Tunisia, stated that it would not be right to consider a brain dead person to be dead as long as essential systems of such a person are alive. So then obviously he has this issue with the heart beating, and then how can you declare somebody dead? So you will always have these kind of opposing views. But then the Majlis-e-Shura in Gatesville, Cape Town, South Africa, made a beautiful recommendation that when those qualified to make judgments on brain death declare such a person brain dead, then the Sharia or Islamic law concurs with this judgment and also regards this patient dead. So, who are those who are qualified? We're not talking about people just with who are religious scholars and others. These are people who are intensivists, anesthesiologists, neurologists. These are the people who are qualified to make that judgment. And I think whether they have a religious bent or not, I think is not commented on. It's just that they are qualified to make judgment. Then the Sharia will support this position. Um, for the deceased donor, it is permissible from the Islamic Fiqh Academy, it is permissible to transplant the organ from the dead to the living on the condition that it has been authorized by the deceased, any advance directives in the will, or by his heirs after his death. And death again may take one of two forms: when all functions of the brain come to a complete stop and no medical cure can reverse the situation, or when the heart and respiration come to a stop and no medical cure can reverse the situation. So this is how these things are. These are some of the recommendations from the Islamic Fiqh Academy. So here they're talking about heart and respiration coming to a stop. Of course, that would imply that the brain is also dead, or even the brain stem death has been considered to be equivalent to death. So when we look at the theological arguments relating to organ donation in Islam, there are pros and cons. And when you're looking at that, we already looked at this and the ayat. Whoever saves the life of one person, it would be as if they saved the life of all mankind. And again, helping your fellow man in life will benefit you after life, the Sadqa Jariya concept. And necessity overrules prohibition. So this is also one of the rules of Islamic ethics, that whenever there is necessity, it overrules prohibition. So example is when you're not permitted to eat dead meat, and not permitted to eat blood, not permitted to eat swine, pork, and all that. But if you are stranded and you have no other means and you're not feeling great about doing it, then it overrides the prohibition, because you have the right to live, and life and sanctity of life and preservation of life is the primary goal. But then those who are against this principle, they say no, necessity overruling prohibition is not applicable in this particular case. The sanctity of the human body is paramount, and you should not violate that after dead or after death or during life. And some of them talk about the predetermination or fate or qadar, and say that this is how it is. So one should just feel comfortable with it, and just take a fatalistic attitude. And some still think that brain death criterion is not valid biological death. When we talk about sale of organs, it is clearly prohibited. So this Dr. Muhammad Al-Bar is a very famous Saudi, I believe he's anatomist or physiologist. I met him. a few times in when I was in Jeddah, and they also, support the thing that um, all previous fatwas on organ transplantation were endorsed, clearly rejected any trading or trafficking of organs, and stressed the principle of ithar or altruism. And when you look at summary of some Ahle Sunnat fatwas, 70 English fatwas, in-depth analysis, all allow for organ donation and blood transfusion. Auto transplantation is no problem at all if done for medical reasons. Like sometimes you have to do auto transplantation of a kidney. For instance, when you have loin pain, hematuria syndrome, you take the kidney out and you reinsert it subsequently, and the pain goes. So allotransplantation, both from a living and dead donor, and also obviously there are some restricted ways in which these are permissible based on some of the theological arguments we presented both sides of earlier on. But transplantation in general is seen as an ongoing form of charity. Xenotransplantation is less often mentioned, but can be allowed in case of necessity. And so these are areas that we'll be challenged with in this century. We will be challenged with the fact that there will be parts coming from pigs and others genetically modified. But again, the basic principle is preservation of human life and necessity overriding prohibition. I think that is what we have to remember. From the Fiqh Jafriya point of view, Ayatollah Hui allowed donation of minor organs but disallowed donation of major organs. And the criterion for major organ was ability to regenerate by itself, blood, skin grafting, bone marrow transplants. The kidney would be classified as a major organ, and therefore, from his point of view, it's not permissible to donate. This is also the view of Ayatollah Jawad Tabrizi. Ayatollah Sistani from Iraq does not differentiate, though, between the minor and major organs. As long as the donor would not be seriously handicapped himself or herself, there's no problem in donating one's organ, minor or major. Therefore, donating a kidney also would be permissible, provided the donor has another healthy kidney. And Ayatollah Nasir Makarem and late Ayatollah Khamenei concur with this view as well. So again, Ayatollah Hui and Nasir Makarem say that donating some of the organs after the death is permissible, provided you have expressed your intention clearly in a will. And Ayatollah Khamenei allowed this also, provided the body does not look like a mutilated body. So the ta'zeem of the body has to be preserved. So donating internal organs would be permissible, but cutting off the external organs would amount to mutilation of the corpse, which is not permissible. Ayatollah Sistani and Jawad Tabrizi do not recognize the validity of such a will at all, and they say that donating an organ after death is not permissible. Ayatollah Khomeini and Makarim Shirazi permitted diseased organ donation from definite brain-dead donors with permission if considered life-saving for the recipient. In general, when we're talking about Christianity, generally it supports organ donation as an altruistic act and leaves decision on individuals. And the Church of England has stated that organ donation is an act of Christian duty. Pope John Paul II also mentioned that we shall receive supreme reward from God according to the genuine and effective love we have shown to our neighbor. In Judaism also, all the prohibitions are set aside if there is possibility of what is called pikuach nefesh, the saving of a life. Thus, when they agree upon brain death and withdrawal of support, they would allow organ donation from the brain dead, as this will save many other lives. So there's a regulated Iranian model also now restricted to Iranian nationals, and it has significantly decreased the waiting list. You basically serve as a donor in a central pool. You do not know who you are donating to, and the recipient does not know who he's getting the kidney from. But then they compensate the so-called donor in this process. However, the con again has been argued by Sanwar Siraj, and he says that the commercialization of humans as organ sellers and buyers is contrary to the Islamic legal maxim of Isar undermines donors of selfless or altruistic motivations. And such an act should be considered immoral because potential donors and recipients engage in a bargaining process, and the practice should not be introduced into other countries for the sake of protecting human dignity, integrity, solidarity, and respect. But however, he suggested that maybe a fixed monetary remuneration as a gift can be provided to a donor as a reward for an altruistic donation if it is uh, truly an altruistic donation. And some people obviously pay for the surgery. Some people provide, subsequent health care as part of the process. Some people provide compensation for potential job losses. So I think these are things that can be still debated upon. But when you're looking at WHO, they have 11 guiding principles, and these were, I think, revised recently as well. That autonomy and opting in is one way of autonomy has to be preserved for organ donation. Opting in, where you have actually specifically mentioned on a donor card that you're a donor, and opting out where the government and others consider not having anything as a form of presumed consent. So one is an express consent, one is a presumed consent, and I think in England they have a presumed consent. Beneficence and avoiding conflict of interest in the case of deceased organ donors extremely important. Autonomy is for and non-maleficence, no, not doing any harm, and justice in terms of distributive justice for living donors with with informed voluntary consent is has to be preserved. Non-maleficence for the legally incompetent and minors. Beneficence donated freely without monetary payment or purchase, and promotion of altruistic donation without purchase. And physicians and health professionals should not engage in transplantation procedures involving any form of exploitation or coercion or payment to the donor or the next of kin of a deceased donor. And I remember that when we were in Saudi Arabia, I was there for about 12 years, and I used to always wonder that all these brain dead donors, how come they always Bangladeshis or Indians or Pakistanis? And the reason is obvious because the autonomy of the relatives was compromised because of the financial incentives that were given. Of course, people are not declared brain dead ahead of time, anything like that, but they had very strict protocols. But then the consent, even from Saudi donors or potential donors, were much less compared with the expatriates, and that obviously was because of some form of payment. Prohibition of fee exceeding justifiable fee for transplant teams. So the transplant team itself should be getting compensation which is commensurate with the expertise and the time spent, but not beyond that. So one has to come up with some kind of a understanding in Pakistan also that what would be considered appropriate. And I think there the government legislation is important. Justice, the allocation rules defined by appropriately constituted committees and based on clinical and ethical criteria that are equitable, externally justified, and transparent. And transparent. So these allocation rules, like you have in the USA, you have UNOS. In Pakistan, we have our own society for organ donation, and so these things have to be totally transparent. Yet we continue to see all these rules that are there in Pakistan being bypassed, being shortchanged, or being exploited, or being outrightly violated. And I think this is important for our society to take a firm stance against these aspects. So for me, when I came to this other hospital that I've been working at last 6 7 years, two or three times I've asked the transplant team and not encourage people who have come to join us to basically just go somewhere else, because obviously their interest was not in uh, ethically sound transplants. Their interest was in commercial transplants or buying and selling of organs. And so that's why I say I have no conflict of interest. I've come out of transplants basically as a protest against the practices that are happening in the country in different parts. So, high quality, safe, and efficacious procedures are essential for donors and recipients alike based on long term documented benefits and harm. And transplant process should be transparent, open to scrutiny, while maintaining anonymity or privacy of a donor recipient. So these 11 rules of WHO are very clear. Now, when we look at living related uh, transplant or living donor nephrectomy, the perioperative mortality is still about 1 in 1,000 at 90 days. For these are for the donors. And so there could be hemorrhage, pneumothorax, pneumonia, UTI, other complications, PE, and all that. And there is a subsequent small risk in terms of end-stage renal disease after 15, 20 years, increase in that risk, preeclampsia or hypertension, depending on the in women, and metabolic diseases such as gout. And but the risk of uh, end-stage kidney disease amongst donors is even though it's low, it's still higher than among healthy non-donors. And therefore, the potential kidney donors need to have full informed consent, regardless of how they are donating totally voluntarily, altruistically, or under some form of a compensation model or whatever. This informed consent is extremely important so that people make that decision. So I have to tell you a very sad story. And it's very funny also because when I was in Saudi Arabia, one of the drivers from from a neighboring country, he just stopped me when I was coming out of the dialysis unit, and he said, "Okay, I want to talk to you about something." And I said, "What?" So he said, "One of your patients inside wants to buy my kidney." I said, "Hey, wait a minute. Let's just sit down and try and see what's going on here." I said, are you serious?" He said, "Yes, such and such patient wants to buy my kidney. He's offered me this and this." So I said, "Yeah, just क्या हालात है तुम्हारे financial हालात क्या है, and what is it that is forcing you to even think about something like that, and just save it for a relative if आगे जाके कभी करना ही है तो." So he heard me, and then when I was walking away, he said, "Doctor साहब, क्या ये नहीं हो सकता कि मैं ये गुर्दा अपना बेच दूं इनको और कलकत्ते जाके, उस जमाने में कलकत्ता था, कलकत्ते जाके दूसरा गुर्दा खरीद लूं?" So can you imagine this sad story matlab, it blew my mind that what kind of societies we are living in with exploitation and all, that somebody is willing to be exploited and also willing to exploit, all because in the name of inequity in societies. And I think this is, again, food for thought for all of us. So 8 to 10% of global live donor transplants are still based on organ sale. So this is a major issue still. In 2007, the HOTA ordinance came in Pakistan for the first time. But in 1991, 75% of all transplants in Pakistan were live related initially. All of them predominantly were done at SIUT. But in 2003, 80% of all transplants in Pakistan were live unrelated in about 12 years, and were done at private centers, mostly for foreigners. And at that time, the packages were $13,000 to $25,000. And even now, I think it must be the same. Now, your dollar has become so strong compared to our economy. So that thing is still continuing under our very watchful eyes of everyone involved, uh, and Twin Cities and certain other part of Punjab and certain parts of Sindh, certain parts of Balochistan. I think these things are going on. Organ, the HOTA Act, then clearly transplants is prohibited in Pakistan. But then there's a Istanbul Declaration and others that came in subsequently on transplant tourism in 2018. They reinforced the 2008 Istanbul Declaration and the WHO guidelines against transplant trafficking and tourism. And they stated that the success of transplantation as a life-saving treatment does not require nor justify victimizing the world's poor as the source of organs for the rich. So this has to be thought of, and this has to be reflected, has to be imbibed. Whatever religious philosophies we follow or do not follow, it's all about humanity. Proposes care, medical and psychosocial, of organ donors for the jurisdictions under which these transplants occur. But especially where organ trafficking and transplant commercialism and tourism is sanctioned. So that is okay if you can provide some medical and psychosocial support. Cost reimbursement does not constitute payment for organ donation. It is due in part to the cost of treating the recipient. So if the government is doing this as a process, and if the donor and the recipient surgeries are covered under a scheme, that should be fine with this, as long as no direct payment is done to the proposed donor, and no commodification of organs is done. And recommends that organ donors be provided with an opportunity to participate in life and health insurance schemes. And of course, some people will debate even that, but I think I'm okay with this. So ISN ethics in 2025-26 are proposing a core curriculum where every trainee should be aware of these critical aspects. Uh, know and uphold the ethical standards set out in relevant international, national, and local guidelines and codes like the Declaration of Istanbul, WHO Guiding Principle, World Medical Association Statement. Explain ethical considerations relating to living kidney donation and apply relevant principles to support decision making about living donation. Explain the principle of financial neutrality in donation and discuss its implication for policy and practice relating to living and disease donation of kidneys. Explain ethical considerations relating to decision making about eligibility for kidney transplantation and acceptance of deceased donor kidney offers, and apply relevant principles to support decision making about transplant. Be familiar with potential ethical obligations relating to prospective and retrospective management of international travel for kidney transplant. Be familiar with ethical obligations relating to the prevention or management of suspected trafficking in kidneys, and apply relevant ethical values and principles in the development and analysis of guidelines for allocation of deceased donors. So this is part of the core curriculum that Professor Dominique Martin has proposed, and I think this is from the International Society of Nephrology, and they are suggesting that all trainees imbibe these principles, and this is embedded in the curriculum for nephrology fellowships or MD programs and others that are there. So just to summarize some of these things that we've talked about, when we look at International Islamic Fiqh Academy, Al-Azhar, Saudi Arabia, Malaysia, South Asia, Iran, all of them pretty much permit brain death. But in South Asia, the Deobandi group probably focuses on the absolute sanctity of the body, so they want circulatory death also. Organ sale is strictly prohibited by all of them. Regulated compensation is permitted in Iran. Excuse me. Necessity, al-darurat tubih al-mahzurat. So necessity permits the prohibited, saving a life or restoring an essential function, allows for the violation of the body's integrity. Harm must be removed, al-zarar yuzal. Medical treatment that removes the greater harm is prioritized. Preservation of life or hifzul nafs, one of the five higher objectives of Sharia. Saving one's life is equated to saving all of humanity. Choosing the lesser of two evils, Aqaf al Darayan, the harm of minor surgery to a donor or violating a diseased body is lesser than the harm of a patient dying. And there should be obviously be no vital organs. There should be informed consent that somebody has to be mukallaf or sound mind, and the probability of success should be high. There should be minimal risk. These are given, and the verification of death, most will accept brain death. Some still require cessation of heart and lungs, prior consent, for example, a donor card, or the next of kin can decide when we are talking about disease donation. Sanctity of the body is extremely important. So, so very respectfully to be sewn again if they're operated upon and organs are removed, and respectfully, of course, buried subsequently. So I end with this hadiths, and for self-reflection, basically directed at myself, and hopefully we can all look at this. So, on the authority of Al-Nu'man bin Bashir, narrated by Bukhari and Muslim, the Prophet ﷺ said, "That which is lawful is plain, and that which is unlawful is plain. And between the two of them are doubtful matters about which not many people know. Thus, he who avoids doubtful matters clears himself in regard to his religion and his honor. But he who falls into doubtful matters falls into that which is unlawful, like the shepherd who pastures around a sanctuary, all but grazing therein. Truly, every king has a sanctuary, and truly, Allah's sanctuary is his prohibitions. Truly, in the body, there's a morsel of flesh, which if it be whole, all the body is whole, and which, if it be disease, all of it is disease. And truly, it is the heart. And so I end with the acknowledgement to Rawalpindi Medical University for giving me the chance to discuss something like this, and to my mentor, late Muhammad Amin, Allah yarhamhu, my transplant team that we are part of at Shifa, Professor Rubina Naqvi from SIUT, a bioethicist and a nephrologist who has given me some feedback. And I was taught by Professor Dibul Hassan Rizvi, and he pioneered the way for transplant in Pakistan. So I will end here, and I will take any questions or comments at this time. Thank you so much for your time.
थैंक यू सर, जज़ाकल्लाह, बहुत अच्छा आपने एक्सप्लेन किए.
So if there are any
Anyone
questions,
having questions?
comments.
Professor Quadri,
Yes, I think, let me say, this is one of the wonderful lecture I ever heard. And not only the wonderful lecture in form of its context and other things, but also in form of the content and the way it was delivered in a very simple language, and with the full reference to the Islamic history, Islamic ethics, and how it is integrated into the modern ethics. So wonderful. Thank you very much being with us, and I highly appreciate your time. Thank you very much.
Thank you. Thank you for the honor, sir. Thank you so much. Thank you.
Very thankful, Professor Quadri, for a wonderful lecture. I think it was very insightful, and the best part was that you've given a very holistic view of the global perspective, that what people are thinking, coming from different school of thoughts. I just only had one question, because I do get in touch when somebody comes and they say that they have to go to a renal transplant, and they want that they should be having a psychological or a psychiatric assessment, that this is not being done by force, and etc. So one of the things which I come across is that they say that this is what the Hota has asked and advised. So one question I have is that when we look into the Islamic perspective of the organ transplantation, is it in cohesion with what Hota is saying, or is there some kind of a diversion between what the Islamic school of thought says about organ transplantation and what the Hota is saying?
So when the Hota came about, a lot of these pioneers in the country were part of the process which led to the Hota ordinance coming through. So it actually reflects the global perspective, the Istanbul Declaration, the Makkah Fiqh Academy declaration, and most of the things that are there in Hota are very sound and very much consistent with the Islamic ethics, Islamic principles. It's just that the interpretation and exploitation of Hota's lack of, I think, ultimate authority is leading to people bypassing some of those laws. So, for instance, that in our Twin Cities, we always get something highlighted in newspapers that something has been done here or something there, and that the donor has done recorded things saying that it's all altruistic donation, and I'm a direct relative and things like that. But I think that is where the problem occurs, that Hota will look at the process and maybe not go into the depth of what went into it. And that's why people still bypass and are able to get away with things which are not consistent with Hota's position itself. So I would say that legislation is important, but then implementation of the legislation just like any other law in the country. I think that is important. And my own thinking about why cadaveric or disease organ transplantation have not taken off in Pakistan is very simple. It's a case of competing risks. So if something is available through a donor who can be exploited, why would one want to go and approach a brain dead donor? So it is so much easier to exploit people. There are towns with single kidneys. People are going around with single kidneys, and that is there. We keep getting this, and it brings a bad name to the country. I remember that when I was taking one of my recertification exams, one of the questions that the American Board of Nephrology put was that this patient went to a country, went to buy an organ in a foreign country, and in bracket he said Pakistan, and this and this and this, and what are the what were the opinions and about that. So I actually objected to that question, and I wrote to the American Board of Nephrology that you guys are not you're out of date with this. There's a law against buying up and selling of organs in Pakistan, the HOTA, and this question should not have occurred. You did not need to write in brackets Pakistan and all that. So they withdrew that question from their pool. But what I'm saying is that all of us, if we can advocate in some ways, we will be getting. We have enough people who have MVAs and can be declared brain dead in Pakistan. We just need to get that straight. And one of the girls from UK, her father was waiting for a kidney transplant for about 20-25 years. And she came and she made a documentary out here, and she interviewed me as well and a few other people here and also in UK. I think it should come out in September, October, regarding the same issues. And so, I mean, like all I'm saying is that we can have wherever we can advocate for above board transplantation and to stop the exploitation. I think all of us can play a role. And wherever obviously psychological evaluation, psychiatric evaluation, extremely important, not just from the fact that it is a thoroughly autonomous and informed consent, but also from the fact that some of these people need to be assessed for likelihood of adherence to medications also subsequently. So if they have a history of non-adherence, they are likely to waste the organs through stopping medications also. So this is another component. So the psychiatrist can play a wonderful role in again the advocacy. And I think you will be able to tell a lot of people who are under coercion and where money may have been transferred in the background. And this is something that is happening, unfortunately, in front of everyone's eyes. But it brings a bad name to Pakistan, which is what we are concerned about. We want to stop the exploitation. There is a group of people who are totally against this. I had to come out of transplant because nobody who came to my center was interested in above board transplantation. So we said we're not going to have it then. As simple as that.
Well, thank you. I think you are very elaborative because day-to-day practice, we do find out that people do try to exploit what even Hota has said and they try bypass. So I think what we are learning now is that we have to be very vigilant about this whole process and should look into that. Is it being done in accordance with what the Hota says? So thank you once again for a wonderful lecture.
Thank you for
Always
wonderful, wonderful
to see
opportunity.
you and to meet you and to hear from you.
God bless you, sir. Thank you. Assalamu alaikum. Thank you, Dr. Lubna. Thank you so much. Assalamu alaikum.
Thank you, sir. Thank you. Allah Hafiz.